All right, we're going to go ahead and get started. Thank you so much for joining us on this beautiful Tuesday afternoon. We're lucky that we have a few participants because I know the weather's so nice. So thank you. Thank you so much for connecting with us. Um, Finger Lakes thought this would be a great way for us to connect with some of our hospital partners since we are at a little bit of a distance from you right now. We were hoping that having an every 2 week webinar series would be a great way for us to keep you updated as to what's going on in here at Finger Lakes. Also provide a little bit of education along the way and provide a forum for you to ask some questions to us as well. So for our very first webinar, we are going to start out today with how Finger Lakes has learned to succeed during the COVID pandemic with donation. So presenting today, I have Bilal Mahmood. Bilal is our clinical director here at Finger Lakes. And Bilal, before I kick it off to you, I do want to share just a couple updates for folks who may not be familiar with using Zoom format. Again, we've automatically put everybody on mute coming into this meeting. We are recording today. If you do have a question that you'd like to ask, if you could use the chat function that is a part of Zoom, if you can type into that chat, then after our presentation is done today, we can unmute your line so you can talk to us directly. Or if you just want us to respond from the chat, we can answer questions that way as well. So up to you if you want to share your screen, you're certainly welcome to. You may have the scared look on your face like this woman on the screen, or we may see one of your kids running across the background, which very well could happen to me. So let's hope those things don't happen, and Bilal, it's all yours.
Thank you, Bill. Good afternoon, everyone. This has certainly been a challenging time for, I think, everyone. I just thought I'd look at some of our first quarter data with organ donation and then the impact of what COVID has, brought upon in the donation community, but more importantly, what our response has been as well. As you'll see in this first slide, it's up to date up until April. We had a very strong first quarter. We had 21 donors up until the end of March, and that's when around mid-March we saw the COVID in our region in the Western New York, Rochester area kind of pick up mid-March. We anticipated April to be a little on the slower side as things were getting busy, but we were still able to manage some donors. But as you see, till April, we have 23 donors. We're well ahead of where we were last year. And we've increased both our brain death and our DCD donor pool over this first 4 months of 2020. Next slide, Bill. So that translates into the numbers of organs recovered as well. Last year we recovered 73 organs by the end of April, and this year we're at 77. Our kidneys and livers definitely have gone up, and we've been trying to focus more on our thoracic pool as well, the heart and lungs. So that has also been a goal where our first 3 months we were really recovering, but then unfortunately come end of March and April, things did start to slow down as expected. So next slide. So this slide is basically the total number of organs transplanted. And again, because our first quarter, we were well above where we were last year in comparison. But after the first 3 months, the recovery pool, unfortunately, not being in the epicenter with New York City, but being labeled in the state of New York, we saw, unfortunately, some good kidneys be not utilized. Unfortunately, we had a string of donors, young, healthy donors with good creatinine where the lists were exhausted. And unfortunately, we could not find a home for these organs. And you see that where the blue line starts to try to slip away from where we were last year, but we're very, almost at par still. But we were having a great start to the year that kind of slowly put the brakes on. Next slide, please. Yep. So here we go again. 77 organs recovered this year with 64 transplants, as compared to last year. We had, by this time, 73 donors, organs recovered. So we have about an 83% transplant rate, which is slightly down marginally by 3% as compared to last year. And we did a lot of number crunching, looking at our donor pools and what was utilized and what was not utilized. And within the last 6 weeks, a lot of it has gone to non-utilization, where you're seeing that little bit of a dip. Next slide, please, Bill. This is a slide that I wanted to share as well with our eligible donors. Up until April 2020, our conversion rates, it was basically a distribution to see, this year we started off strong, and by strong, I mean not strong hospital, but in general, all our smaller hospitals and our B's and C hospitals, and it was well distributed, and we saw donor activity pick up. Arnett was 2 eligible donors that we were able to convert, as does Krause, Samaritan, and St. Joe's in the Syracuse region. And so that was really good to see some of the, apart from our main 2 strong and upstate hospitals, having that clinical activity and bringing the donors home there as well. So shout out to all those places as well. Next slide, please, Bill. So this is more of a national data based off of our UNOS website, which is our governing body, United Network of Organ Sharing. If you can see the graph on the left, the green line is 2020, and the blue line is 2019. And that is a national graph. And as you can see, nationally this year, organ donation was well ahead of where it was in 2019. But if you look closely, if you can zoom in on your screen, come about mid-March, you see that green line 2020 start to close in the gap, getting closer to where we were, where things started to slow down. On the right side of your screen, this has been drilled down to the Northeast region, which covers about 8 states, including New York State. And you can see the impact, because being the epicenter, we were doing great. And then as soon as March 17th onwards, you just see how everything just started to slip away. And the Northeast region was severely impacted by the COVID crisis pandemic, which I'll also break down into the next slide, please, Bill. So again, the national data on the left here, you see when it's about March 8th to March 15th, you see that steep decline, and then it kind of flattened out on the bottom there below. And as of end of April, nationally, the organ donation is starting to pick up, and you can see it's on an uptick swing. That's usually our Midwest centers, Midwest states, Texas, and the West Coast as well, where the pandemic wasn't as rampant. And if in comparison, if you look at the slide on the right here, this is, again, the drill down to Northeast weekly basis. And like clockwork, when you see March 15th, it just goes nowhere but down, straight down up until the April 5th. And, that was just basically 6 donors happening per week on average in 8 states. And that was the severe impact of COVID, more so in the Northeast region as compared nationally. But the good news, as you see, as the April progressed as well, that is starting to move in an upwards direction as things were starting to flatten the curve nationally, but more importantly here in New York State. And as you know, we're in the process of our phase rollout system as well, which is going to only help bring back the pre-COVID levels for donation. What the new normal will be, it is yet to be discovered, but severe impacts in organ donation, almost to a virtual standstill. But despite that, Rochester, Finger Lakes, and Syracuse, we were still able to, in March, April, continue with organ donations. But unfortunately, this selective screening processes with our transplant centers, and also the fact that anyone outside of the state would not want to come and recover or touch an organ that was labeled New York State. And that was just unfortunate. Next slide, Bill, please. So that was basically what the data was for our first quarter, and then how it transitioned with our impact of our COVID crises pandemic. So that severely impacted operations on a clinical level that was pretty much unprecedented, that no one was prepared for. I don't think any of the hospitals were prepared, as this began to evolve. But some steps we did take into navigating through this, as we continue to do right now, as things are starting to ease up slowly. Our first and foremost practice was our PPE, our universal precautions and safety for our staff, but most importantly, other staff members as well. The face shields, the masks, the gloves, the sanitizers. We made sure that we would be stocked up from not only our university base, but also making sure we were providing all the proper equipment, just like you guys have been all receiving at your respective hospitals as well. The second big decision came when in March, when things got really scary, was our process and how we were responding on site for our referral activities that were coming through. We decided to go towards a more mobile environment and start more remote following, and that resulted in increased calls in the hospitals. We were doing a lot of check-ins, leaving EMR notes, but building charts remotely, and not having our staff respond on site, only if until it was absolutely necessary, if there was any brain death testing that was in process, or if there was a family withdrawal care of plan meeting that was scheduled as well, and there was some potential for organ suitability. So we really made sure that we changed our operations and how we responded to referrals. I know when referrals activity also slightly changed March into April, we saw a lot of, it was all about COVID. And, there was, the overdoses, the strokes, the MIs, we were left scratching a little bit of our heads as where did that referral activity go? The amount of activity did not decrease significantly, but the quality of the referrals were different. And that's something we've started to trend as well. But as things are starting to ease up, we are responding more to our level 1, which we call processes of herniation impending, or if there is actual declaration or scheduled family meetings. And that is something we're continuing to work with our hospitals to make sure nothing is being missed while we're, following from afar. We made some internal changes for our safety regulations as well for our donor social histories. This was more on a national level, where a lot of the COVID-specific questions were included into our medical social history. We also did decide that we would be testing all our donors for COVID-19 testing. We are using the NP swab kits at this time. And we, thank God, over the course of time, have had better turnaround times in our testing results, which has made an impact on the recent donors we've had. I know a lot of the hospitals are testing patients when they come in. It's more frequent and routine, but when this started, we were quick to make sure that we had that availability. COVID-19 positive test results are an absolute no to organ donation. And then we are also found ourselves retesting our donors because we see patients come in, they get tested in the ER or early admit to the ICU for any suspicious activity for infection or to rule out COVID. And they may be negative, but then they might be in the unit for a couple of days before it converts to a potential FLDR and referral. And in all safety precautions that we are taking, once it becomes consented, we send out our own COVID-19 test that we will bring on site as well, and it's tested off site. Our transplant import criteria also changed quite a bit. Again, no one wanted to do anything with New York State, but then we have transplant recipients that are also on the list. But then a lot of our donors were coming from our Region 9, New York City, but we saw our own local transplant centers respond with caution as well, with kind of indirectly impacted what we started to pursue as a suitable organ donor based off of noticing our trends of the living donation was pretty much on a standstill. The donation after circulatory death was very selective, and the imports were also starting to get selective as well. But there was a lot of changes that now I can say 6, 7 weeks in that there are discussions as things are opening up and we're seeing transplant continue, that these are starting to readjust to somewhat normal levels. Because of our remote access following and no case activity, we made sure that we had a busy first quarter month. The staff was working a lot of cases. We had 21 in the first 3 months yet alone, donors. So we adjusted our call schedules as people were more mobile and case activity decreased. We made sure we had just enough coverage that we can follow remotely, and also give not only our staff a little bit of pseudo breaks, so to speak, but just still make sure that we were operationally having enough staff that could get the job done with what the current picture clinically was providing in the face of COVID. But we also utilize this time internally on the clinical end to start our long-term goals of being accredited with AOPO, which is the governing body for accreditation. So Rochester could also be a part of that. So we try to utilize this time to update our policies and our procedures and standardize some of our internal processes, which we have started as well. Last but not least, it's been a huge, huge learning curve. A lot of it was a first for hospitals, for ORs, for ICUs, for OPOs, our staff included. And how are we going to have that first donor? What will it look like? How are we going to react? But, those were the tough times that we learned from our hospital partners, but we also learned from our shared experiences from the cases. As we did them more, we found our rhythm. And as things are starting to ease up, we are looking for 100% trying to get back to pre-COVID levels in the year that we had, and just making these adjustments. We've learned a lot internally, as a lot of hospitals have as well. And we're just going to try to see how we can manifest that to translate into continued organ donation activity from an operations standpoint. I know I've spoken a lot in the last 10 minutes, but I just wanted to get through, just what we are doing and how this has impacted us. Bill, I think this is my last slide, I believe.
Yeah, I think it is, Bill.
Thank you.
No, thank you. Thank you. So I thought I'd take a spin off from what Bilal talked about with our operations and how we were able to make sure that we could make donation happen during this time frame to remind everybody how important those referrals are that are coming into us. As we've been in the grips of COVID and seeing the effects throughout the country, one thing that we have seen, and we've seen in New York City, and we've also seen locally, is that how sometimes through this difficult time of this pandemic, when donation can happen, it really inspires people to realize amidst everything else, lives can still be saved. And we, again, our donor being able to help another person or multiple other people can be a huge, it can be very inspirational, not only for the family, but also for the hospital as well. And we've seen that at a couple of our hospitals that really rallied around to make sure that donations still continued. So I did want to remind everybody what our referral triggers are and when to notify us. Again, if you have a ventilated patient with a poor prognosis and you meet any of these below criteria, that's when you contact us. So I'm going to break down each one of these individually. So first, if you have a patient that has a Glasgow Coma Scale rating of 5 or less due to their injury or condition, that's the time to call us. So again, for eye-opening motor response or verbal response, intubated patient, obviously you're going to get a 1 point there. Likely a patient that doesn't open up their eyes, they will get 1 point for that. And this patient at best may be posturing of some sort to pain or may not be moving at all to painful stimuli. So that best motor response is going to be on the lower end of the scale as well, which will give you that 5 or less. Also, those patients that are missing 2 or more brainstem reflexes. this is when we need those referral calls to come in as well. Just because you refer the patient doesn't mean that this patient won't survive, or it doesn't mean that there may be a different outcome for this patient, but it does mean it's a patient that we do need to know about, so we can begin to determine should end-of-life decisions be made, or should the patient progress to brain death, do we have opportunities for organ donation that either we can honor this patient's first person authorization, or we can offer those options to the family. So that's when we start to follow this patient and determine, is this a patient that we will have options for donation for? When considering transferring a ventilated patient to a higher level of care or a hospital that has a different level of care than maybe you have for monitoring a patient for continuous EEG or for additional consults such as neurosurgery. If you're transferring that patient, please, that's the time to give us a call as well. Likewise, if you have a patient that won't be transferring from your hospital, maybe you've called for a transfer and they have suggested that you do keep that patient at your hospital. If that patient is meeting our referral criteria, please give us a call. We have the ability to make donation happen at every one of our donor hospitals. And we are determined to do that. So when there's an opportunity for donation, we want to make sure we can offer that to the family and carry it through in any way that we can. When you're initiating therapeutic hypothermia or that targeted temperature management protocol, these are patients that we want to know about as well. We know that those protocols are initiated to preserve brain function, and if you're initiating these protocols, it's because likely there's been some sort of significant neurologic event. So please, we're asking that you call when you initiate those protocols as well. And last but not least, when you are starting to have difficult conversations with families about either comfort care, end of life, withdrawal support, brain death testing, any of those times, if you haven't notified us as of yet, this is a really important time. Again, the sooner the better for notifying us. If we can be on site for a conversation with a family about donation, that is always best. And those phone calls to us in a timely fashion will help us to do that. Last piece that I want to highlight, it really is that calling within 2 hours. This is something that we haven't done a great job with throughout our region, and timeliness is super important. Sometimes those patients that transfer to another facility or that have quickly decompensated, decisions are made very quickly in the hospital setting. And again, we would really like the opportunity to evaluate that patient and to be on site for the best possible opportunity to discuss donation with the family in the most comfortable way for them. Normally, the most comfortable way for them is to be in person in a private setting when we can plan how that discussion is going to go. And that's why that timely notification is so critical, so that we can mobilize the right people to be there at the right time for those conversations. From there, I wanted to open it up to questions. So let me check and see if we have any questions that have come up so far on the chat feature. So far, I have not seen any, but I am more than happy to unmute somebody's line if they would like to ask a question. If you can, again, just type in that you want to ask a question, and I'd be happy to unmute your line, or you can unmute your line yourself, and feel free to ask a question. It's about 2:25, so we have about 5 minutes for questions. Again, if anybody would like to ask a question, you can type into the chat. Just type in that you'd like to ask a question. I can unmute you, or feel free to unmute yourself and go ahead and ask the question. Rob, while I'm waiting for any final questions, Rob Gruenfelder, I know you had asked before if you could just take a minute to thank our hospital partners for their continued support of donation and their hard work during this time frame of COVID. We know it's impacted all their hospitals. So Rob, while I'm waiting for any final questions to come in, I'll give you a second to, that I'll get you unmuted here as well.
Yeah, thank you, Bill and Bilal, and welcome everyone. What an amazing, amazing time we're living at, and a very scary time. First of all, I know donation is just one small aspect of everything you're trying to cover. Are we still live? Okay.
We are. Yep.
In your hospital environment. So we're trying to limit our exposure to you guys, as well as keep you informed of everything going on. We continue to try to save lives through organ donation and transplantation, and you are the critical link that are essential to make that happen. I think we're starting to see some changes in referral patterns where sometimes the donor, the cases that were being shipped to the larger institutions, maybe are being kept locally at your facility. So I would encourage everyone to continue to look at those referral triggers that Bill mentioned in his remarks. But also, if you're unsure, to give us a call to help the screening process in order to make donation happen. You guys are amazing. I'm a nurse by training, an old ICU nurse. My wife is still a practicing nurse as well. So it really affects all of us from a healthcare professional as well as personally. So thank you for what you're doing. We appreciate it, and let us know how we can continue to support you, as well as improve donation throughout our community. People's lives are depending on it. It's amazing. Bilal was talking about some of the difficulties that we've encountered in the Northeast with placing organs. And we did for a period of time, but the transplant centers are opening back up. They are transplanting organs, and they're finding out ways, just like you are, how to continue your operations and continue to expand and grow and serve the communities. So thanks for everything you do, and please ask whatever you want to. We have the people here to answer your questions.
Rob, thank you so much. While you were talking, we did have a question that came up, and Anna from Oneida, if you're okay, I'm going to unmute you, and feel free to ask your questions. I'm going to unmute you now. I think I am. You might need to unmute yourself.
Hello, Bill and everybody.
Hi, thank you.
I was just curious. I know we're a much smaller facility, so organ donation doesn't happen as often as tissue or cornea. And I didn't know if you had any information related to that happening at this time, or that would come from MTF and the iBank.
Yeah, so Bilal, would you like to, can you answer this one?
Yeah, hi, Anna. So, during the crises, things were changed for the eye and tissue recovery process. But as of earlier this month, the 11th, the Lions Eye Bank and the other regional eye banks that may be servicing, they are operational. At least the Lions Eye Bank is back up and running, as is the MTF process of eye tissue screening. So those two are, also back into the groove of things, so to speak, as things are starting to reopen up.
Great, thanks, Bilal. Anna, thanks so much for asking the question. Other questions from the group? We are just coming up on 2:30 right now. Again, we have recorded this presentation, so we will be sharing that recording. So we would encourage you to share it with your peers or other folks at your hospital. And we thank you so much. Our next presentation will be coming up on June 2nd. Will be our next presentation. And I believe we are going to do an overview on the New York State laws that have recently been updated. So that will be coming on June 2nd. Thank you so much, and everybody get out and enjoy the beautiful day. Thank you.
Thank you, Bill.
Thank you.